Following the recent election in the United States, our team here at Male Contraceptive Initiative has felt compelled to share our thoughts related to the growing legal and political challenges that reproductive rights face. Access to contraceptive services, including abortion and other reproductive health options, are at an increasing risk of restriction, posing a substantial threat to the health of women and the well-being of families across the country. In these times, we at MCI tend to see a substantial increase in outreach from the public, particularly men, asking what they can do to help protect women from the increasing risk of unintended pregnancy associated with such restrictive reproductive health policies. While there are many methods of male contraception currently in development, we are still a ways away from methods being available on the market. In the meantime, the best way you can support male contraceptive development is by using your voice. Be heard, be counted, because the mythological messaging that men or people who produce sperm do not want more contraceptive options and that women or people with uteruses don't support increased male methods of contraception persist. You can also sign up to participate in future clinical trials for methods currently in development or for newsletters from product developers. You can play an active role in bringing male contraception to market because, as it stands, contraceptive research and development does not exist in the traditional pharmaceutical sector. Current efforts rely almost exclusively on non-industry funding, so making donations and investments a critical need. Expanding access to male contraception will play a vital role in supporting reproductive autonomy. By broadening contraceptive options for men, individuals and couples gain more shared responsibility and control over family planning, reducing unintended pregnancies and strengthening both partners' ability to make reproductive choices that align with their needs and values. One of the core messages that we promote at MCI is that contraception should not be gendered or simply a choice between two alternatives. True reproductive autonomy means that everyone has a right to determine their reproductive intentions, both as an individual and as a couple. At MCI, we will continue to push forward to support and advocate for the field of contraception. I'm fortunate to work with men and women who are passionate about what we do, but I'll let them speak for themselves.
The choice of if and when to have children is one of the most important decisions that anyone can make in their entire life. In fact, it's so important that I consider reproductive autonomy to be a fundamental human right. Reproductive autonomy for all is a vision that I share where everyone has the tools and the ability to choose their own destiny. When it comes to male contraception, this means making sure that men can productively participate in family planning and that they can relieve their partners of the contraceptive burden. More than that, it also means that they're availed of the contraceptive opportunity. Contraception has helped me and my partner pursue careers and education, and now we have 2 young children that will grow up in a world with decidedly different reproductive rights than the one I grew up in. It's exceedingly important for us to remember that our decisions will impact their future and for us to fight for what's right today.
As a woman of reproductive age who is currently trying to prevent pregnancy, I depend on access to safe and reliable contraception. I want to decide for myself when and if to have children, and I want others to be able to make that decision as well. That's why I'm grateful for MCI's work to make reproductive autonomy for all a reality. I'm also grateful for the many individuals and institutions who are advocating for novel contraception and working in the contraceptive research and development space. Personally, I'm very lucky that my husband is supportive of whatever family planning measures we need to take to prevent pregnancy, meaning that he's willing to step up and contracept as well. However, contraceptive options for men are lacking. I hope that in the future, men will have more contraceptive options available to them to ensure that no matter if you are an individual trying to prevent pregnancy in a couple, or maybe already have children, that you'll be able to find a contraceptive method that works best for you and your health in order to prevent unwanted pregnancies. I hope at this time more than ever, we can come together to make reproductive autonomy for all a reality.
When I think about male contraception, I think about it from a couple of perspectives. And the first is the public health perspective. Looking at it from that point of view, we know birth control and reproductive care in general, and healthcare in general, can be hard to access. And it's likely to get harder to access, more expensive, as we see some changes in healthcare coverage and in access to reproductive care specifically going into the new administration. Personally, I don't need male contraception, and that's the other perspective that I look at it from, but I want other people to be able to have it. I want other couples, other families, other bodies, other lifestyles, other relationships, other family planning needs. I want it to be accessible for other people in the same way that I have found contraceptive care, reproductive health care, and family planning that work for me. I want that to be available to everyone.
Hello, my name is Aaron Crapster. I'm a scientific research fellow at the MCI, but this message concerns reproductive rights and reproductive autonomy in this country and around the world. Improving family planning is now more important than ever before. The reality in the US is that without federal protection guaranteeing a right to abortion, many people now have limited or in fact no access to abortion providers. And within this reality, I think we should take a step back and double down on better forms of contraception. It does not matter what political, religious, or moral belief someone has, contraception is upstream of conception. And unfortunately, the contraceptive options available today are not good enough or not sufficient, considering nearly half of all pregnancies are still unintended. We need safer, easily reversible, and effective contraceptive choices for both women and men. And I urge everyone listening to think more deeply about how they could support novel contraceptive development. The impact goes well beyond reproductive rights and maternal and children's health, but it starts there. Thanks.
Hi, my name is Dr. Will Skinner, and I'm a sperm scientist and male contraceptive researcher currently working as a visiting scientist at the MCI. I've been working on developing new forms of male and unisex non-hormonal contraceptives for years because I believe it has the potential to make significant improvements to the physical, social, and economic well-being of people around the globe. In these times, as we face a much more uncertain future, full of accelerating natural disasters, eroding female reproductive autonomy, increasing inequality, and political violence, I believe it is more important than ever that every person has access to effective tools that they can use to have only the children they want when they want. At MCI, we are working every day to accelerate the arrival of new forms of contraception that can make this dream a reality. Please join us. None of us on our own can control which way the political winds turn, but once new forms of contraception reach the market, people will always find ways to access them. We can't control everything, but together, let's develop ways to allow every person to control their own fertility.